Hello, good morning. This is QTV This Morning. I am Ibrahim Abalde. Thank you very much for joining us. And of course, we are back again on another edition of your morning program where we do the newspaper review and also discuss community watch social issues. And we also invite our newspaper review guest on this program to help us review some of the stories on the newspapers. But today we are going to change the format of the program, for a very urgent segment. And Mr. Adedrame is the co-host of this program. Good morning.
Good morning. Mr. Bala, you've spoiled my line. I always say to people, this show is like the morning cup of coffee without having to have the morning cup of coffee. But he's actually had an actual morning cup of coffee, so it's kind of spoiled.
It's not virtual this time. It has to be here.
It's a pleasure.
So we will be starting with the Sunyureu Medical Mission in the Gambia. Sunyureu Medical Mission 2026 is a healthcare outreach in the Gambia. Of course, bringing together local and international experts to provide free screening, education and mentorship while promoting community health awareness. And we have Victoria Lesong Richard Owutu. Yes. I'm sorry, sometimes pronouncing these names could be a problem. Founder.
She's a Gambian, by the way.
Founder and director of Sunyureu Medical Mission to the Gambia, and Dr. Olebisi Adikoya.
That's right.
Volunteer doctor.
Yes.
Ladies, welcome to QTV This Morning, and thank you very much for coming.
You're welcome. Glad to be here.
Yes. So let's start with your mission in the Gambia. Let's start with the founder. Please, can you tell us about this medical
Why
mission?
did you feel the need to found such a mission, really?
Yes, I think it started in 2016. My mother told me to do something about the healthcare system because we knew that she would always come to the United States to get her medical care, right? So when she said to me, I can't come anymore, I freaked out. You know, I gave her every excuse why she should keep coming. Yeah, and she looked at me and go, you see the same energy? You're complaining about why I should come and why I shouldn't come, why I shouldn't stay. Use that same energy to do something about what you say is wrong. And I looked at her like she had lost her mind. And she said, rather than complain, do something. And
like your mom already?
Right. Yes. So that's how it started.
That's how it started.
Yes.
And Olabisi, we'll come back to how it kind of grew up for that. How did you get involved?
Victoria is a good friend. I'm a founder myself. I'm originally from Nigeria. So it's a pleasure and a privilege to join forces to be part of something bigger than ourselves, especially when it comes to healthcare. I personally have experienced issues of healthcare, like losing my dad while I was in the US, my mom having an emergency in Nigeria. Most of us abroad in the diaspora have a story of something that shouldn't have taken somebody out, but that it happens. But again, like she's rightfully said, and her mom said, what are you going to do about it? Because we can talk till tomorrow, we can complain, but what's the change that we're going to make? So it's my pleasure to be a bridge between the diaspora and home and make a change for our people.
Okay, and of course, as Olabisi Adeyemi tells you that I have, my great-great-grandparents came from Abeokuta.
That's fantastic.
And settled in Sierra Leone. But if
wonderful.
I can come back to you, Victoria.
Yes.
So that was the founding of it.
Right.
So when was the first mission, and what did you do on that first mission, and how has it grown since then?
Well, the first mission was in 2021. It was just me.
Right. Okay.
Just me. Because I think when I realized that the very thing that I was worried about was literally happening before my eyes, because my mother literally was sick, and I knew that that was no point of return. So I remember falling on my knees, but just crying. I didn't really cry. The pain in me just propelled me into starting that mission. I didn't even have a name then. I didn't have a name. I knew I wanted to do something in her honor.
Right.
So I know I just went to the School of Medicine and Allied Health, went to the physiotherapy department because my auntie started that department, Mrs. Olandau. She started that department, so I went straight there.
That's what at Edward Francis
Yes,
Small.
at the RVTH, Edward Francis Small.
As
Yes,
it was at the time.
yes. So that pain, I went to the physiotherapy department because my goal was to just honor my mother, honor my auntie. And I just started, what do you need? What do you need? What do you need, right? Scholarship, so I just gave it. And then my cousin, Dr. Charles Roberts, was like, over here, come over here. Come to the School of Medical and Allied Health. And I saw the need, and I was like, oh, okay. So I came back, went back again, right? Again by myself. But I started talking. People started seeing the passion in me. And then 2024, boom, 15 people came with me. Right. And now we're, in fact, now I think we're up to 18. Yeah, some people couldn't make it, but it's like, we went from 1 in 2021 to about 18 right now. And they're all volunteering. Nobody's getting paid, and they're paying out of their pocket to even be here. So it's the passion that they saw in me. That is the passion that I see in them. And it's like, it's been a labor of love, but worth it.
Yeah, that's really impressive and inspiring.
Right.
Let's talk about the kind of health care services that you provide.
Okay. This year it's, I mean, I think we've been growing, but this year has been a very grounding moment because in the midst of having anesthesiology.
I'm glad you said that word because I saw it there and I always struggle with it. So thank you.
You're welcome. You're welcome. Yes. So in the midst, in addition to all what we're doing, we have anesthesiology. Then for the first time, the very first Gambian trained vascular surgeon. Gambia does not have a vascular surgeon. He chose our mission to come, and his name is Dr. Momodou Lamine Jammeh. Right, very first, right? So now we have vascular surgeon. They snatched him up from day one because they had a list of people who needed vascular help. Then we have pediatrics. We have infectious disease. We have pharmacology, right? We have chiropractic medicine. We have physical medicine and rehab. We have physiotherapy. So did I miss anything?
Yes, pediatrics. Did you say pediatrics?
Yes, I said
Did you say wound care?
I see. Now there's, thank you. You're reading your notes, good. So wound care, you know, and she was floored because that's the issue. We don't have a comprehensive protocol for wound care. So we're having gangrene, we're having amputation, we're having unhealed wounds. It's a problem, you know. So we have that array of subspecialties and specialties that are with us.
So Gambia being a country, and most people are diabetic, and you know, I mean, what kind of service do you provide for those people?
Like for instance now, tomorrow. Take, for example, tomorrow, May 7th, we're running with the University of Gambia Medical Students Association and the team of clinicians coming. We're running 2 health fairs. One at the Gambia Academy with Dr. Jonas Jobate, and then at the Fandema Women's Skills Center in Tujereng with Malang Sambu. We've already recruited 100 villagers at both sites. We're going to be screening for diabetes. We're going to be screening for hypertension. If they test abnormal, we're going to write them down and tell them, make sure that they are followed up by the cardiologist, Dr. Lamine E.S. Jaite, because I hear there are 3 Lamine Jaites.
That's right.
So they're going to be followed up with the cardiologist, and then we have a hepatologist, Dr. Esobite, and a nephrologist. So it's not a case of screening them and saying, okay, great, you're abnormal.
So I wanted to ask that. So what will happen after the screening?
They go see the specialists at the hospital, and Sunyureo will be responsible for any additional costs. Luckily, the teaching hospital gives our patients free care, which is a no-brainer. They help us out. But if they were to incur additional charges like medication or something they can afford, this is where we step in to help out.
So for you, Victoria, this is Olabisi, this is your second visit. So on the first visit, what did you do? And what made you want to come back a second time?
That's a good question. So I personally have been doing medical missions since 2014. So when I joined the Sunaru first mission, I came to support and to observe.
Right.
And of course, you come with an open mind and fit in wherever they put you. So what did I do last time? I gave a lecture in clinical trials to the students and my colleagues as well. And then I supported with the health fair. And really, when it comes to preventative medicine or primary health care, you don't need much. But once you can attack it from the basic, it won't get worse. Yeah. So things like diabetes. And another thing we did last year was education.
Yes.
Educating the people about knowing your numbers. What does the sugar level mean? Right. What is your blood pressure? What are the numbers?
We can test you. And that is the one.
It doesn't show on your face if your sugar is 300, you know, but it means you're sick. So it's not something that's obvious, and people think they're fine. And another good thing, education is very key. And another good thing is about knowing that diabetes and hypertension, as basic as they sound, they're chronic conditions. So when your medication finished, which happened to my mom, when her medication for diabetes finished, she thought diabetes was gone. And then it ended up, sugar increased and she ended up with stroke. And this is why it's personal and it's important to educate our people that it's important you know your number and what the numbers mean.
Right. Victoria, if I can come to you. I was fortunate to be at they had a surgical conference a couple of weeks ago, and I was fortunate enough to MC one of the days. But one of the things that really struck me was that a lot of people talked about conditions that they find in our hospitals and clinics in terms of cleanliness.
Right.
And in fact, the presentation that was given there was the one that really made people sit up. And they were saying that there's a WHO checklist about what you should, and they said that many of them are not even using that. So when you go around and you observe things like that, do you give advice and say, look, you should be doing this, you should be doing that, in terms of the conditions in which people have to
hygiene.
The kind of clinical hygiene.
Yes. Yeah. That's part of the thing. There's something called, we're doing like quality assurance, QA. Right. So we're taking notes. Because the clinicians are all taking notes because I can't be everywhere, right? So they come back to me and say, oh, this. So at the end of the mission, I sit down with the powers may be, and I say, these are the things we were observed. What we have identified the problems. How can we help you, right, fix the problem? So yes.
I mean, what I like about this, and it kind of plays into what Olabisi said, that, she's volunteered in other countries. I mean, here on this program, we've interviewed Cuban doctors, Spanish doctors, other doctors from America who had no connection with. So it's good to see our sisters and brothers being the ones who are at the forefront of this.
Right.
And so, for you, Victoria, if you've started it, it's developed, how do you see its sustainability kind of going forward? Because, this takes funding. I'm assuming you're smiling because I'm sure that must resonate with you. Yes. But sustainability is a thing because we hear about these fantastic initiatives.
Right.
But then they kind of run out of steam.
Exactly.
Because they run out of funds. So
right.
How sustainable is it? And if you need to make an appeal, make an appeal.
Of course. I'm not too shy to beg. I will beg, borrow, steal, whatever.
But sustainability, if you could address that.
Sustainability is key to it. Luckily we have an organization, and a humanitarian organization, Zakat Foundation. Zakat Foundation of America.
They work with SONA at the academy.
Right. So Zakat Foundation of America have taken us under our wing to help us out, because they said, you are a very small organization. You're going to get choked. You're going to get suffocated if we do not help you out. So they have started giving us micro grants, and just to April 8th, they were able to deliver a 40-foot container filled with medical supplies, because they came to me and they said, we need to help you out. What do you guys need in the hospital? So we had a needs list from the hospital, Dr. Bite. So he gave us, and the thing about it is sustainability is funding. I don't get grants from the United States. People think I have grants. No, we don't. some of these doctors pay their way in.
Yeah.
I, for one, I'm determined not to let this dream die.
Yeah.
So whatever I have to do, we're also asking for partners on the ground. It's good that we're coming, because a lot of us are leaving our homes, the comfort of our homes, because we feel the need to come back home. Because my mother would tell me, whatever you do, never forget where you're from.
That's right.
Never forget where you're from, right? So that is the need. It's not easy. I have dumped all my savings into this, but I don't care. So as we are helping, they're not getting paid. Nobody's getting paid. People think there's a money bag somewhere. If they find it, please let me know, because I will shake it.
The magic money
I
tree.
will shake that money tree, right? But we're looking for help. We're looking for assistance. We're looking for people to step up, you know, to say, hey, you guys are coming. I will foot this bill. Let me take care of this. You know, let me do this, right? We don't have to be influencers. We don't aim to be influencers. We're trying, sunyureu. That's what it means. We're taking care of our people. Our people need to take care of us too.
Absolutely.
Right? It's, we say in Creole, one hand they wash the other hand. Right? One hand washes the other hand. That's it. We're giving our all. Please, whoever is listening.
Yeah, so it will be important to engage Dr. Olabisi here. So what are the common conditions that you're seeing at the hospital at the moment?
Again, there are so many conditions, because one thing leads to another. And it's important that people know what is going on with their body. I always talk about prevention is better than trying to cure something. Like when I met somebody who had a high sugar, and he told me, oh, I stopped my medicine because it was 6,000 naira, the diabetic medicine. And I asked him, I'm like, do you know how much dialysis is? Because if you don't manage your diabetes, these are the things that can happen. Your feet, your legs could be amputated, your kidneys can fail, blah, blah, blah. And he said, oh, I don't want dialysis. So in comparing and putting things in perspective, he managed his diabetes, you know, because walking around with a 388 sugar level is dangerous. I'm like a 30-something-year-old. So again, it's about educating people. And I want to bring it down to even students, children. When we educate the children about hygiene, about health, when I went to schools and I talk about my mom's experience, the students ask me, please, how can we see if somebody is having a stroke? Because they'll go back home and they will educate their family and their environment, and they spread the word. So I think education and healthcare are the basic things to save any nation. And it's a privilege to be here.
I use the quite brutal term, not educate, indoctrinate, particularly when they're young. Indoctrinate them in good habits. And then they grow up to be healthy people. Because they've got that. But one of the reasons I was asking about sustainability is about, do you have a vision to scale this nationwide?
Oh, yes.
Because obviously that requires funding, that requires more people to come on board and so on. So if you could see, if you were to project 5-10 years, what would you like to see Sunyureu Medical Mission have grown into?
I would like for Sunyureu to partner with the Ministry of Health, because they already have a system in place with the community health workers. The goal is for us to scale up to the point where we go into these little villages where the kids want to come to the city. No, stay there. Stay in your village. We want to train you to look for visit grandma, visit grandpa every day, right? Look, see if grandma is okay, if she's slurring her speech. We want to train them on how to see the first signs of something going bad. Teach them how to take blood pressures. Teach them how to do this glucose, right? And then because the Ministry of Health already has a system in place, they will report to the nurse, who now reports to a doctor. But then it's not just the Gambian doctor, because the Gambian doctors are stretched to the limit. But we have doctors. That's what you call telemedicine. So it's a case of, if they need help, call Sunyureu. Sunyureu will connect with one of the doctors in the United States, in Nigeria, in the United Kingdom, right? And then further down the line, what is my goal? To have what you call a medical resort. Medical tourism is huge.
Yeah.
Rather than gather all your dollars, gather all your money to go to Senegal or go to, no offense to Senegal, rather than go, let me put it out there, Senegal is big brother, right, don't come for me, right? So rather than go abroad to spend all that money abroad, come to the Gambia, because we have the clinicians. Having the manpower it's no big deal. We have the manpower. So that is the goal, 10, 15 years down the line, is to have a medical resort where people come to the Gambia, right? Get their treatment that is world class. The economy is going to be stimulated here. All these young children who are dying, trying to go across, will have hope instead of hype. We give hope, not hype. So that is what Sunyure wants to do. We want to restore hope. We want to restore the belief in the Gambia. This is our country. We have to be able to build it. Rather than go outside to look for help, let us do it here, because we are coming in.
Training to come in. Yeah, please.
You're right. One of the things I also like that you do is including the medical students, the young ones. In my experience, it's important that we create the framework for our youth, for our children. When we're talking sustainability, we are running the race. Somebody gave us the baton. And as we bring those young ones alongside with us, they are the ones we're going to hand over the baton to. Don't drop it. If you drop it, pick it back up. And keep it going. It's a sense of responsibility. But what Sunyure is doing, by bringing people that look like them, profiles, that's showing them the possibility, what can be. You don't have to leave the continent. You can go to another African country and then come back. Bring the experience back home. And I think I like that, because we include the young people. We were given, like I said, we give, and we hope that it continues to give.
Yeah.
So the length of this mission,
it's important to highlight autistic children as well.
What is what?
Autistic.
Kids with
autism.
Autism. It's important for us to highlight that.
Right.
I mean, there are many children that are autistic in the Gambia, and most of these conditions are associated with witchcraft or jinn. You know, so is there any point in your programs where you incorporate this?
Yes. So yes, for the first time in the Gambia, we're working with the University of Gambia Medical Students Association, and we're working with this organization called the Gambia Autism Support Advocacy Network. Yeah. Right, we're working with them.
We've had them on
and I'm the one behind the scenes training them, because they were like, they reached out to us to say, help. We know that autism is real, but we don't even know what it's all about. So behind the scenes, I've been holding training for them like twice a month, right? We've been doing that. So this year, for the first time, we're incorporating autism, where on the 9th of May, between 10 to 2, at the School of Medicine and Allied Health Sciences, we have experts. We have the pediatric neurologist, Dr. Chijoke. We have pediatricians. We have people on the staff on the team who know what autism is all about. And we have invited parents, medical professionals, you name it. You want to know about autism? Come here, because it's a 4-hour interactive session of dispelling the myth of what autism is, and showing you how to recognize, and training them what to do, and then finding the right type of care, because autistic kids are very intelligent. They're very smart, but they have been excluded from the system because they don't fit into the normal, right? There is beauty in the abnormality. They are very unique. So we want to include them because they add to society, right? Nobody should be ashamed of having an autistic child. There's nothing wrong with an autistic child, but we do not know what it is. So what do? We'll point the fingers. And that is one thing we are trying to do. We're trying to create an awareness. And then that's happening on Saturday at the School of Medicine and Allied Health.
So creating this awareness, I mean, I think it should just go beyond that event only. Sometimes I think we can include culture, arts, tradition, I mean, to be able to teach our people.
Yes.
They do that.
We do that. Yes. Check, check, check.
Because each person there is a way you understand.
Check, check, check. Yeah, and that's the thing. Sanyure, we're holistic. We're holistic. We believe in science and we believe in the arts because we know that arts and culture is what we're grounded. That is our foundation. So we partner with the Silicon Valley African Film Festival in San Jose. Like last year, we had short films on grief, vitiligo, diabetes, hypertension, schizophrenia, and we had a snippet. We had people coming in to watch. There's nothing as powerful as storytelling, because when you see it, you don't feel alone. You don't feel left out. You feel like, oh, there's a community like me. And then you actually learn, right? So we also use films to tell our story. And that's why we believe in arts and culture. Like, and again, we have even taken it a step further this year. In addition to showing films, we're celebrating arts and culture. Again, that May 9th in the evening, where we're also going to be showing films, but this time around, it's on resilience. And one of the films we're showing is a Gambian kid who was born deformed. He was disabled, but the boy did not let his circumstances define him. He's a powerful musician, and we want to spotlight him because he has been shunned. People look at him and they just want to, you know, look away or they stare at him. But no, we're using this platform.
I think I've seen the guy.
Laxmiel, right? Amadou Sahor. So we're spotlighting him like there's nothing wrong. If you're different, there's nothing wrong with it. Embrace, you're not your disability.
His ability is
you're not your deficit. Your deficits don't own you or make you. You have to define how your trajectory is going to be. And then the other film we're going to be showing, again, curated by the Silicon Valley African Film Festival by the gracious Mr. Chike Nwafia. We're showing another thing about resilience, believing in yourself, right? Those are the things that we're going to show. And then we're also going to the grassroots level and dealing with people who are making a difference, because a lot of people in the Gambia who are making a difference are not celebrated. They're not celebrated. And no, you're not paying for your award. We've handpicked them and they were stunned when I called them to say, how many times have you been told thank you? And there was a
silence.
I said, so guess what? Sunyureu Medical Mission, we want to honor you. We want to pay homage to you. And please come, let us celebrate you.
And you know, we have this famous saying in the Gambia, our people are not celebrated until when they are no more.
That's not just in the Gambia. In many
so ladies, I'm afraid we've come to the end of the program. Finally,
when does the mission end?
The mission ends May 17th.
Right, okay, May 17th.
Yes.
And where will the films be shown?
It's going to be at the Penchami Hall on the 9th. But because, again, we didn't have enough funding, it's by invitation only, right? But if we have funding, this is something we can open up to a lot of people.
And if anybody's been invited, donate on that day.
Hello.
Absolutely.
Thank you.
Yeah. So this is all we have for this segment. Thank you very much for coming.
Thank you.
I wish you all the best of luck. And
Thank
Gambians also should definitely support
Yes.
this initiative.
Thank you so much.
Yes.
Thank
So
you.
we'll be right back after the break. This is QTV This Morning. I am Ibrahim Abalde. From that Sunyureu Medical Mission, talking to the team, Victoria Lesong Richards Ohutu. Yes, and Dr. Olebesi. Now we will go to the usual newspaper review with Mr. Momodu Mboj. Mr. Mboj, good morning. How are you?
Good morning, Balde. I'm all right.
Have you taken your coffee this morning?
No, I haven't.
You haven't?
I haven't had my coffee yet.
Yes.
Balde is the only one who's...
So we will delve straight through the one of the papers. That's the Standard newspaper. The main headline, which reads, you know, Dabo Sidinjai claims he once declined Dabo's invitation to join the UDP. Well, these are, you know, things that we expect from a political opponent at some point. As we know, December 5th is almost here. We are in the political year, and each political party or each party militant will do what you have to do so that your party can win. So are these statements very relevant at this point?
No.
In short, they're not.
They are not.
I mean, because you've
is it the timing?
Because you've said the magic word in an election year, particularly in a presidential election year. The election season pretty much starts from the 1st of January, and then it's kind of people are electioneering for the whole of the rest of the year. So they're saying things that they think will either damage or distract people or whatever, and that's all this is. You know, next week somebody will come out with some other statement saying something different. So
probably it's just to undermine Dabo's influence, maybe. But the timing, it's not relevant. Tell it to the Marines. Tell it to the Marines.
Pretty much. And I guess Mr. Mboji's initial kind of thing tells you that's the attitude we should take to a statement like this. You know, treat it, you know, for what it is. You know.
So I mean, what do you think the UDP, you know, leadership will respond to this? Because I mean, they keep throwing shots at each other.
There's nothing to respond to in many ways. What were the circumstances? Why did he decline?
Yeah, quite.
I mean, quite obviously with this statement, he's dissing UDP.
Yeah, quite,
you know, I'm not this one, I will never join UDP, which is a diss.
Yeah, quite.
So, this is quite tabloidal stuff. I wouldn't waste much time on this, really. It's not significant.
So there is another interesting headline.
Good.
I mean, the IEC registration supervisor resigned over alleged intimidation.
Yeah.
I mean, you know, that's really surprising.
Who is intimidating him?
That's what I was going to say. Was it that he was intimidating people, or did somebody intimidate him or her?
That we would have delved into.
So it's because it's kind of, you know, was he intimidated, he or she intimidated, or were they?
So what it's saying here, allegations of intimidation within the Independent Electoral Commission (IEC), a red flag for democratic stability. Okay, the use of quotes around resign suggests there may be more to the story than voluntary departure. Probably.
Well, yeah, as you said, it says resigned in quotes, which kind of leaves it open to interpretation.
But I don't think you have to resign when it is attached to maybe a party that is not in government. I don't think so. When you resign, probably you resign because you want to avoid other things, because there are people that are on higher authority than you.
Well, they're just, you know, maybe not even a political party, maybe just within the...
I don't think oppositions can make a person
Not
resign.
within... No, I said, that's why I said not necessarily political party. It might be within the working environment that the person feels they are being intimidated. But I think, you know, because it's the IEC, we've assumed that political parties, or you've assumed that political parties might be involved. It might be just work colleagues that intimidate this person or whatever. So, yeah.
Well, I think now, due to the political season, we'll be hearing a lot of these things.
Shenanigans.
Our country, it's a small country, but the politics is huge.
That's it, as I normally say, small, but sort of no less complex than anywhere else.
Some people will tell you it's a small country to run until you are there.
Until you, that's it. You're given the reins of power.
They don't just say it's a small. They don't just say it's a small country to run. They say because it's small, it's easy. And I always rubbish that one, because it's not easy. If it was easy, somebody would have done the easy thing and solved everybody's problems. People will always have things that, you know, they're not happy about, no matter who's in power. That's always going to be.
So how can we forget the case of our brother Omar Baji,
we cannot.
the incident that happened in Mandinari, where now we cannot say alleged police brutality. Now we can
go
say
the coroner.
As
the coroner said.
The coroner finalized, I mean, due to
trauma.
yes, so
and that report has now been set.
Yes, the government promises to take appropriate action in Omar Baji's case.
Yeah, and another on the Observer, it says the Attorney General receives coroner's report on death of Omar Baji. So it's in their court now, no pun intended. The ball's in their court, and let's see what happens.
So will this case impact public trust on the Ministry of Justice?
I'm not so sure. This is just one case. Obviously, how they handle it, how AG's Chambers handle this one, maybe might restore, I do not know, modicum, as it were. Yeah. But I doubt it. You need more than one case for one to restore public trust.
But you know,
but why did you say that? Why did you think the Ministry of Justice might be the ones impacted? You mean if they don't take the case forward, or what did you mean?
Well, recently there are a lot of things that are surrounding our justice system. At some point, you know it better. You are at the newsroom. You know. So when the government handled this properly, does this mean okay, now people are getting more confidence again in the justice system? They said there are lies, damned lies, and statistics. Okay, so when people threw this at the Justice Minister that they were losing all these cases, he came out and said, "Look, actually, cases that the state prosecuted, we won 78%. But of course, what people then pointed out were the big cases, the PRU shooting cases, and the like that they lost." So those ones are the ones that grabbed the headline. They said 78% that they won. Who even knows about them? So it depends on how the public perceives this. But the coroner does recommend prosecution, and if they don't take forward prosecution, then that could shake the trust in the system. So this is reminding me of
absolutely, and even with that 78% before you come in, when I heard it, I said, yes, I'm well done. What does it mean? Does it mean the way you messed up, that's okay? It doesn't tell me anything about the shortcomings, as it were, especially with the Jaite ruling. It was scathing.
It was pretty damning. And the thing is, the 78%, they might be easy wins.
Easy wins, yeah.
But the ones where you have to do a lot of work, like the PRU shooting case, even before it ended, when we were hearing the evidence every day, we were like, this guy is going to walk from this place. The evidence was lame, did not tie him to nothing tied the individual charge to the incident. And when Justice Jaite gave his judgment, he did not beat about the bush. 22 pages of scathing stuff. He lambasted them. Yeah. And for them to have the cheek to say he didn't know how to interpret the law, that was an insult. Because he showed in his judgment, he knew damn well how to interpret the law. And he said, you have not proved your case. And that's going to be the yardstick. Can they successfully take forward and prosecute?
So this case is reminding me of the shooting incident that happened, an extrajudicial killing in Nigeria. One Mr. Ogedi on the 26th of April, he was shot by a police officer and killed at a point-blank range, where he was, accused of carrying something like a gun, right? Where he said he didn't know what was in the bag. He was given to a friend. So police brutality, it's kind of similar to this case, sort of.
It depends. I mean, I don't know if you want to comment on that, because this guy, you mean the Omar Baji case? Yes. He was supposedly being chased because they thought he had drugs, or that he was involved in drugs. And the reason why there might be a kind of doubt over kind of police credibility, not the Ministry of Justice, was because of the statement, the initial statement that the police put out. The coroner's report says that was absolute rubbish, that what they said was a lie in layman's terms. They're obviously trying to cover up, because the coroner's report goes on to say that the injuries were not consistent with somebody just tripping and falling. So
it's totally this. That's Boncom. You can call it Boncom. Yeah, so we can talk about politics. We talk about a lot of the extrajudicial killing. But however, let's move on. Ajib Bank CEO Jawara appoints Vice President of WABA.
Appointed.
Yes, appointed, rather. A win for the Gambian financial sector, been appointed through the West African Bankers Association, gives Gambia a strong voice in regional fiscal policy.
And a huge win for Ajib Bank as well. And we would have had her on the platform if it wasn't for the fact that she's not in the country at the moment. But it's a huge thumbs up.
How will this benefit Ajib Bank's regional expansion? Because the intention of every conventional bank, your purpose is to reach other nations as well.
Well, what would it send? What message would it send out there? Well, the head of Ajib Bank is
very good.
Is a very good banker. Absolutely.
Right. You know, and so for the bank's credibility,
absolutely,
it's great. As for its expansion, banks that expand have to be very careful how they expand. Sometimes it's good to know your market, kind of stay in your lane, and don't kind of stretch yourself. But obviously the credibility, and now anybody seeing her name and seeing the words Ajib Bank will go online and say, oh, let me find out about this bank. So straight away it shines a light, and a positive one, on Ajib Bank, one has to say. And honestly, congratulations and thumbs up to her.
That would be
it's wonderful.
That would be nice. Yeah. So let's talk about climate and infrastructure. Gambia needs over $13 billion climate financing. World Bank. I mean, GT Board explores new partnership to salvage unfinished eco lodges. However,
so which one do you want us to take?
However, the project of these eco lodges started a long time ago, since the time of Minister Ahmad Bah.
We know. Yeah.
We just started with few blocks, and it didn't continue. So what can we do about this? Are we going to trust this? Is GT Board going to do this? Is the implementation going to be easy?
It's, you know, the reason we want eco lodges in the Gambia is because, first of all, the eco part of it is kind of ecologically friendly, but also we've seen that they work in other countries, and we want to emulate, replicate, whatever you want to say, that kind of success. But with all of those, if you look at them, whether it's in Kenya, in South Africa, in Ghana, there's a kind of infrastructure that supports the eco-lodges. They don't just sit there, and if you build it, they will come. It doesn't work like that. You have to aggressively promote them and say why they're good, and that will then attract the people that you want to attract to them.
So in fact, I mean,
you wouldn't want GT Board to be building ecologists just for the private individuals. That's really for private entrepreneurs, really to do that sort of thing.
To be realistic.
Of course. So of course it's not going to work.
So Mr. Momodumbo, in fact, let's be realistic here. Where can we source this $13 billion? Where can we source this? I mean, we have other, you see, we have to be very, very realistic in our dealings. It's not just coming up with numbers and coming up with headlines, but it's important to know what is realistic as a people. You know, where can we source 13 billion while we have other urgent things that are waiting for us?
No. Ecology and climate is equally important and is not waiting for us.
Yes,
the world is changing around us. But this is the stark reality that if a country as small as the Gambia needs 13 billion, what does that tell you about what the rest of the world needs to address and you know, climate financing? These seem like fantasy figures, really, because they seem just, as you said, there are so many other things that we have that we see as priorities. And sometimes things that is a priority or things that are priorities, we don't see them as priorities, you know, until it's too late. You know, you go along the shores and you see all the sand mining that takes place in some communities. That is seriously detrimental to those communities. And yet we just see it and we just let it go. So those 13 billion is just a kind of
But
crazy.
13 billion is not even a small money to mention, talk less of putting all that money together.
To collect it. No, it's
putting most of these West African nations, the money that we borrow from China, it's not more than $5 billion or $6 billion.
I mean, if you put it into context, Gambians last year, by conservative estimates, remitted $1 billion to the Gambia.
Can you imagine?
In 1 year. So there are things where we have to be clever with things like climate financing. Can we get the diaspora, for example, say, okay, you're going to send money to your family, we know, but also your family live in the Gambia. If you want Gambia to survive, why not every time you send $10, you put $1 or $2 into a particular fund? That's just a kind of climate fund. We need to own these things, and we don't need to go begging for stuff. We need to find our own solutions.
We do not have the structure, Mr. Ade. Let's
but if we keep saying we don't have it, we will never have
the structure.
No, we have to put it in place.
Imagine Mr. Mboj used to send $100 every month to the family, and you tell Mr. Mboj you have to put at least $10 for climate financing. Mr. Mboj is not going to allow that.
No, how do you know? How do you know? How do you know?
Well, you have to build the structure.
That's
it. Doesn't just happen.
It should start somewhere.
You just said the magic word. It has to start
somewhere. The chicken and egg question, which one first? That's really what the problem is.
Yeah.
Because we'll probably have a problem of trust.
Yeah, quite. Yeah,
it is really a problem of trust.
Yeah.
But given the right people, given the right governance, I think a lot of people outside would be willing to do all sorts of things.
Let me give you an example from Rwanda.
Really? Yeah.
Because our Africa Foundation for Development, we were involved in it. So Rwanda wanted to have a bond, a diaspora bond, to use the money to build houses for civil servants. And they needed $10 million. They'd never done anything like that before. They think, oh, how are we going to? So Dr. Jibril Fall, who you guys know from here, helped put this thing together. And guess what? When it was launched, within 6 months, they raised that money. They never thought it was even possible. It seemed like a fantasy.
And it happened.
It happened, and the houses are built. So
in Rwanda?
In Rwanda, you know, and they built, because what they wanted to do, they wanted to build houses for civil servants, public servants, close to where they work. So they save on travel costs. They get to work early as well. So the money you're spending traveling from Brikama to your office.
Yeah, that's how we eradicate poverty at some point.
It. That money you save instead.
So let's deal with local news. I mean, when I talk about local news, I mean it's things that happen in our communities. There's a man, few days back in Brikama, a welder man. I mean, he grind and sharpened his cutlass and entered in the Brikama market and macheting people. I saw a picture of a man. If I still imagine seeing that, it's too graphic. I am afraid the individual is going to lose his leg because his knee was cut. At some point, you can see the cartilages and the kneecaps. You can see everything plain blank. And another incident too, somewhere around Brikama, a man was, his hand was cut to a point where it will never be attached.
By the same individual?
No, I think it's a different but these incidents, they happen simultaneously. I don't know. How can people do that? The police are under investigation.
Yeah, things are, of course, they will investigate, but we need to get the details to know, particularly with the first one, going to the market with your machete. Does he have mental health issues there?
You know, if these are random people who've never done him any harm, why did he do that? So you have to assume somebody has mental issues. But I think also sometimes we need to sort of be realistic. I shouldn't, but sometimes I engage with people online because there was an incident when about 3-4 months ago, it reported that 2 men who were neighbors had a fight and one of them stabbed and killed the other. And people were blasting the police. And I'm saying, oh, so the police should be in every household, making sure you don't have an argument with your neighbor? It's such a stupid thing to say. That, oh, I blame the police if the police were... like, what would the police have done? Go around the country, kind of, arbitrating between neighbors, thinking that one of them might be violent. You know, things like that happen, and there are some things that are beyond the reach.
You know, we have to start taking responsibility.
Of course.
And if we have people that are insane in our homes, we need to start controlling them.
We need to just have mental issues.
You know, sometimes we have the psychiatric hospitals here, but for you to take your individual there, that it's more of a stigma and discrimination sort of.
Did you say hospitals? I think we have one.
Yes, we have it.
There's only one.
The tanka.
You said hospitals.
Yes,
you said plural.
We have hospitals.
Yes, we have
I thought there was another one.
Not much. We don't need
No, I thought
two or
there's.
three.
No,
But
we need
we
many.
have tanka here. But sometimes you can see people living with insane people in their homes. The other day, within my environment, there is a lady that treats people that are not okay. People will bring their people there. So I started seeing these people roaming in our streets.
Right.
And I alerted my community page that I'm seeing people that are roaming here, and these people are not okay with their behavior.
Let us be careful here.
Yes.
Well, just because I have mental health issues
Doesn't mean I shouldn't roam.
doesn't mean that I'm psychotic.
Yeah, go ahead.
You
Or
know what I mean?
dangerous.
We have the extreme sort.
yeah.
You know,
But
when
you
you
can
become a
never
danger. Granted, but
Yeah,
let's be careful here.
Yeah.
I do not know. I mean, we can never eradicate crime entirely.
No.
They tell you any society you go to, maybe 1% of the population they are psychos, psychopaths. You have another maybe 1 or 2% who are sociopaths.
correct.
Most societies you go to, you have this sort of thing. So the point is really for law enforcement, how do we minimize? Isn't it? That's really what you can do. And then when certain wrongdoers are apprehended, what do we do with that? So it's a question of minimizing it, controlling it. The idea of eradication, because when I hear you talk, it's as if you want to eradicate it. I'm not sure how one can do that.
Well,
I'm not sure whether any society has been successful.
Interestingly, Mr. Mboj, you want to, how do we control it?
Yes.
You understand? But you see, sometimes in the process of controlling it, danger happen. And when danger happen, that's the time you realize, okay, I should have said this long time ago. So now we have got to a stage whereby we are not going to see how we are controlling it. We are going to talk about it to find solutions than just how do we control it. Because if a person that is insane is roaming your community and you know this individual is not okay, and okay, I want to control it, you have to talk about it. You have to find solutions.
You see, you're using this blunt, the word
Insane.
person is insane. You have different levels of mental health issues.
So do you want me
different,
to find out what type of
different
level?
categories, different categories. No, we have to be subtle in our thinking about this. When it comes to social policy, don't be too emotional and using this blank.
Okay, Imam Jah doesn't want 10-15 minutes. He wants his full time.
He'll get his full time.
So, Mr. Adedrame, you are dismissed. Mr. Mamadou Mboj, you are dismissed.
Yes, indeed. We're happy
You people need to leave my studio.
to be dismissed.
So thank you, Mr. Ade. Thank you, Mr. Mamadou Mboj. It was a good session with you people. I learn a lot when I'm here.
Thank you.
You know, Mr. Mboj, I'm starting to think the way you people think.
Oh, yeah?
The way you cogitate.
We better go for a commercial break at this point.
Yeah, so we'll be back. This is QTV This Morning. My name is Ibrahim Abalde. Now let's move on to the last segment of this program. And now we have Alhaji Usman Jah, Islamic scholar, Imam of Taqwa Mosque. And we'll be discussing a very important topic. And, you know, he will help us clarify, you know, this topic today. Imam, ñu ngi la dalal si programme bi. ñu ne la bismillah.
Bismillahi ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alamin. Wassalatu wassalamu ala ashrafil mursalin sayyidina wa nabiyyina Muhammad wa ala alihi wa sahbihi wa sallama tasliman kathira. Mr. Weltare, ñu ngi lay nuyu di la sant ci dalal gi nga ñu dalal ci sa programme bu am solo bi. Di nuyu hit bokk yi ñuy seetaan ci biir ak ci biti réew di ñaan yàlla lépp luñ fi wax yal na dëppoo ak bëgg-bëggam.
Amin. So Imam, tey topic bu ñoo waxtaane relationships before marriage, Islamic view. Ndaxte loolu lu am solo la pour ñu seet ko ñu waxtaan si. Man bu ma gisee topic bi suma xel lu bari daw na si. So ñu taana ko ñu ne ok nañ seet imam ndax dinañu mun a indi ay leeral ndaxte tey da ngaa gis ne balaa ay nit sax di sëy dañoo ne foog ñu jël some time ñu xamante balaa ñuy dugga si sëy although man suma dëkka it's a total different thing because man fu ma jógee suñ xamee ne yow ak kii yéen a ngee ànda rek sëy boobu duñ ko taka waaw ñun yëpp noonu lañ dundee moo tax ñun buñ demee bañ bugg a taka suñ jabar yi buñ defee suñ intention bi duñ dee gisee sax dañ dee daw bugguñ nit ñi gis ñu so lan la islam wax si loolu
jërëjëf jërëjëf weltaare naka nga tudda
Cerno Ibrahima Sori Balde
Cerno loolu dafa bare wàññi ko
dafa bëri waaw Ibrahima Balde
waaw Ibrahima Balde thank you Mr. Balde ci li nga indi tey soo ko xoolee na day mel ni topic bu wow la meaning am fa matériel yooyu mën a def jox time dafay xaw a jafe ci ñenn ñi parce que li nga indi dafa mel ni masala la rek moo xam ne question la ñu tontu la ci once and for all waaye xam naa kuy tëral topic ñaare su fekkee amuloo background ci li ñuy waxtaanee loolu moo la dee dugal ci yenn yi but whatever the case topic la boo xam ne incha allah danaa ko enrich ba nga xam ne at least nit ñi dinañ ci mën a jëriñu bi iznillahi taala first of all sa laaj bi da nga ko ëppoon dafa ëppoon ba ëppa because yaa ngi ko tuddee ne relation before marriage
waaw
relation before marriage is too open
waaw
waaye man léegi dinaa ko jéema ngir foog naa li nga bugg a laajte
waaw
dinaa ko naj foofu
waaw
mooy comme farak jànqa
waaw correct
waaw ba pare nga jàllar bi ko
boobu la
waaw ba jàllar bi ko takk borom
waaw
lan la ci lislaam
loolu la ci islam
good li may njëkk a wone mooy lislaam dafa oo jullit ñi daf leen digal pour ne góor a jigéen nañ séparé toujours nañuy sori waaw li ko waral it mooy yàlla mooy ki liggéey góor ak jigéen te moom moo xam lim def ci góor ak lim def ci jigéen ak suñ jegeexee lan moo ci mën a juddu problème yi ci mën a juddu donte nga xam ne problème yooyu taxut a jóg yàlla waaye daf laa yóbbu ci li tax a jóg yàlla lim bañ mooy jëflante góor ak jigéen te fekk sëy doxu fa ñu di ko tuddee njaalo for exemple
waaw
moom la yàlla bañ léegi nag lislaam ñaare suy tere dara dafa tëj bu yoon wi nga war a jaar dem ci loolu moo uutalee lislaam ak suñ loos yi ñuy tëral yi nga xam ne man-made law la man-made law lim la tere na la ko feeg defuloo ko loo mun a def so eboo nga ñëw ba jege ko feeg defuloo ko amut ak yow affaire lislaam nag su la teree dara doo fa mun a àgga
mu ne la wala
daf lay tere yoon yi ngay jaar pour dem fa moo tax lislaam ne la góor ak jigéen goo xam ne duhut koj armal ñu di ko tuddee relative boo xam ne mënuloo koo sëy te loolu suñ ko waxee mooy sa yaay boppa ak ñam bokkat say tanta sa bàjjan ak ay bokkam sa doom bu jigéen ak lum suufe sa sista suñ waxee sista mooy ki nga bokkat ndey ak baay wala ngeen bokk benn baay wala ngeen bokk benn ndey lu dul loolu du sista ci lislaam lu dul loolu du sista
soo leen bokkut ndey ak baay
waa benn sista suñ ko waxee ci lislaam mooy ki nga bokkat ndey ak baay wala ngeen bokk ndey rek wala ngeen bokk baay rek
waaw ñooñu sa sista lañ
sista waaye kudut kooku du sista waaye ñun sista dañ ko dee yaatal too much so ñooñu dagan na góor mingul ak ñoom maanaam góor mun naa mingul ak yaayam doomam bu jigéen sistaam
waaw
bàjjanam tantaam te suñ waxee tanta mooy ki bokk ak sa yaay ndeeg baay wala ñu bokk benn baay wala ñu bokk benn yaay
ok
waaye out of loolu yëpp du tanta
kooku du tanta
non du tanta ci lislaam suñ waxee bàjjan ci lislaam mooy jigéen ji bokk ak sa papa ndeeg baay wala ñu bokk benn baay wala ñu bokk benn ndey ku dut kooku du sa bàjjan ci lislaam meaning ñii ma tudda nii mënoo cee takka kenn jabar waaye ku dut kii mun nga koo takka jabar
waaw
yes ku dut kii mun nga koo takka
ok
so loolu la donte ñun dañ ko yaatal lool léegi lu tax lislaam may góor mu mën a mingul ak ñii aaye ko ku dut ñii foofu lislaam mu ngi wax ak góor gi nga xam ne xelam mi yàquwut xam nga doomu aadama ci nature bi ko yàlla bindee yëpp mbaax la yonent bi sallallahu alayhi wasallam dafa wax ne kullu mawludin yuladu ala fitra fa abawaahu yuhawwidaanihi aw yunassiraanihi aw yumajjisaanihi ku judd ku ne ci mbaax nga judd ñu ne ko bon nag ñi yàqu ñi bon lu tax mu ne environnement bi leen wër la environnement bi la wër moo laa bon la waaye yàlla du def lu bon léegi ki ñuy waxat fii mooy nit ki nga xam ne néecoom yàquwut kooku du toog ak yaayam wala bàjjanam wala tantaam wala doomam bu jigéen wala doomam bu jigéen for exemple wala système ba pare xelam di daj ci ñoom dara
waaw
ki loolu mooy ki néecoom yàquwul waaye xam nga ne am na ñu seen néeco di yàqu
waaw
ba ñuy tëdd ak seen ndey
waaw
tëdd ak seen système
waaw
kooku taxul ñuy wax kooku néecoom dafa yàqu kooku amatut rule amatut atte
waaw
fuñ ko mën a tënk
système bi yàqu na
waaw système bi moo yàqu su fekkee ne nag nit ki mu ngi des ci système am bi yàquwut ñii mun naa wéet ak ñoom nekk ak ñoom te dara du happen waaye ku dul ñii óoluhuñ leen óoluhuñ ne soo nekkee ak ñoom dara sa xel du dem ci leen waaw because siixlu wuloo leen amuloo ak ñoom blood relationship boo xam ne dafay tax nga siixlu leen comme que siixlu wuloo leen kon bëggante mën na faa jaar su bëggante jaaree lu nekk mun na faa jaar loolu moo tax islaam teqale ñu pour bu ñu mingul ak jigéen joo xam ne man xaraamut la léegi nag waaye ñu toxu ci beneen point waaye góor gi tam ak jigéen ji yëpp liñ bëgg mooy suñ jotee sëy nañ sëy pré sëy naka la nit ki balaa moo sëy naka la balaa moo sëy l'islam am na lu ñuy tuddee xitba mooy nga wone sa intention moom la defe naa moom ngeen di wax am na si anglais nu ngeen koy waxee proposal
waaw
am na proposal ci l'islam itam
waaw
xitba mooy nga wone sa cofeel sa bëgg-bëgg ci ndaw si dama ko bëgg a takk am naa cofeel pour takk ko takkaguloo ko waaye am nga ci cofeel léegi mu des nag ci société bu ne seen aada naka lañ koy defee ci ñun jamono tey bi góor gi ci boppam comme que practice suñu l'islam ba góor ñi dañuy dajeeg jigéen ñi di toog ak ñoom même ki nga bëgg a takka da ngay toog ak moom di wax ak donte tere nañ la ko
waaw
mën nga ko propose mën nga ko won ne ko man dama la bëgg a jabar for exemple li jaadu woon mooy bu leen mit bu leen toog loolu mooy li l'islam tëral
loolu la l'islam wax
tëral waaye suñ demee ba mu am nit ki mun na ko wax ne ko dama la bëgg a jabar waaye di normal procedure mooy su fekkee da nga gis jigéen joo xam ne da nga ko bëgg a jabar da nga koy wax say péereen ñoom ñooy jël guru yóbbu ci péereen yi ndaw si wane ne suñ doom dafa am xememteef pour sëy sa doom suñ jëlee guru gi na waaw nangu nañ loolu maanaam amuñ ci benn problème loolu moo tudd proposal moo tudd xitba jamono boobu nag jigéen jooju du daganati benn góor wax ak moom dafay mel ni fi ne daanaka sëy bi li ci des rek mooy dañ koy kile naka la tuddaate dañ koy officialize naka nga ko tuddee dañ koy def mu officiel
waaw
waaye bi nga xamee ne wane nga ne dama bëgg seen doom ñoom ñu ne d'accord nañ maanaam bési takk bi rek yooyu moo des loolu moo tudd xitba
so léegi benn góor amul
right dafa xaraam sax yonent bi daf ko tere
waaw pour nga dem jël
ne benn góor bu mu xam ne am na moromam góoram mu bugg a diw sàng ba pare moom itam mu dem di ci dugga dafa xaraam yonent bi sax daf ko xaraamal dégg nga de digg boobu nag moo tudd xitba digg boobu it am na certain kii buñ la may am na luñ la may waaye not even ngay ànd ak moom ak wéet ak moom ak nangam loolu mayuñ la ko déedéet waaw waaye sañ nga koo gis par exemple ki nga xam ne moom nga bëgga xam nga bu njëkka ak tey bokkut tey àddina bi dafa yàqu àddina bi fi ne jigéen soo ko bëggee balaaw ko parents yee yëg sax li yàlla xam doy na dégg nga waaye balaaw àddina bee yàqu ki bëgg a jigéen ji du ko gis sometimes sax parents mi ñoom ñoo koy utal jabar ñoo lay wax ne la sa kër nijaay am na jànq bu fa ne nangam wala sa kër bàjjan am na jànq bu fa ne nangamati nangam booba góor xamut jigéen jigéen xamut góor li ma miin góor sax wala jigéen xamutoon lu ñuy tuddee nopp because ndem nekkuloo di mingul ak jigéen yi nekku di mingul ak góor so pour moom ay lu ñuy tuddee nopp ak yooyu daanaka xamul loolu góor yëpp benn lañ rek noonu la koy gisee moo tax bu njëkk soo yóbboo guru ne dama bëgg a diw sàngam suma doom xale bu jigéen bi su ko papaam laajee wala yaayam daf koy wax man papa koo bëgg naa ko loolu la daan wax te moom sax gisagut waa ji waaye bëgg na maanaam ndem papaam ji bëgg na mu sey bëgg na ba because xamul luy nopp tey nag dañ dee teel a xam nopp because da ngay judd rek di interact ak
di mingul ak
jigéen di toog ak moom di ànd ak moom dem school di toog ak moom ci benn banc di bokk ak moom programme nangamati nangam soo fi ne moo tax fi ne nit ñi xam nañ nopp xàmmi nañu moo tax léegi li nga daan mun a def sa doom bu jigéen doo ko mun a def tey li nga daan def sa doom bu góor doo ko mun a def tey bu njëkk mën nga koo tànnal jëkkër ba pare te dara du ci génn waaye tey kenn waru koo def
waaye xam nga ne imam islam du dee change rules am because of
non
système
non
islam du
non su dee loolu rule du amati di
waaw
su jamono yàqoo warta tax ñu change système dañoo war a defar jamono su dee loolu benn rule du taxawati
waaw
loolu la léegi jigéen ji ci boppam comme que dem nañ ba propose nañ ne dañoo bëgg a sëy bañ ne waaw fi ñu toll nii loolu lañ la ci may man nga koo gis man ngaa ñëw ci kër gi ñu oo ndaw si mu génn nga xam ne kii laa bëgg noonu lañ ko daan defee waaye léegi nañ bàyyi boobu na ñu ñëw ci jamono bu yàqu te mooy yow moo la tax a jóg
imaam boobu dañ ko war a waxtaan
waaw jamono bi yàqu te moo la tax a jóg mooy
waaw
tey góor géeg jigéen ji dañuy xamante fekk sax xaajaguñoo jota sëy ba ñuy dem school fa lañ gisante woon fa lañ buggante kenn ku ci ne dina fi yëg ci moromam ne kii sopp na ma maanaam daal itte woon na ma sopp na ma donte waxul la benn woo dama la nopp wala moom itam waaye ci seen ni ngeen di àndee ni ngeen di waxee kenn ku ci ne dina fiil ci boppam ne kii am na lu muy yëg ci morom ka ba dee jot boo xam ne xëy na dinañ li ñuy wax dinañ ko wax li nga yëg di nga ko wax benn jigéen ji wax ko wala góor gi wax te léegoo-léeg jigéen ji du ko dee gën di wax ci li ëpp ak góor moo dee gën di wax soo moom itam mu nangul la ko mu wan la point blanc ne moom itam defe ne li ngay fiil la fiil for exemple ngeen di ànd ci loolu ba pare am seen full freedom ci ne saa yu leen neexee génn fu leen neex dem léegoo-léeg mingul googu ngeen di ànd wéet googu ngeen di wéet léegoo-léeg lu gën a xaraam rot ci even ànd bi ngeen ànd ci boppam daganut waaye duur moo tax a jóg yàlla fi ñuy wax daganut bi mooy njaalo tëdd gi waaye yoon wi mooy lan mooy dajee waxante laalante ci loxo maanaam teg sa loxo lëngante dégg nga fóonan ngeen baal ma fóonante raayante yooyu yëpp mu ngi mooy yoon wi la yóbbu ci li yàlla gën a bañ li yàlla gën a bañ mooy njaalo loolu moom la gën a bañ waaye yii sharia daf ko ci boole daf ko boole ci yu bon yi
waaw
ngir lépp lu lay yóbbu ci lu bon la loolu benn principe la ci islamic jurisprudence dañoo wax ne lépp lu lay yóbbu ci lu bon la dañ koy jox àtteeb lu bon te ci cosaan bonutoon waaye ndem daf lay yóbbu ci lu bon kon léegi dafa mujj bon léegi ci biir ànd googu li gën a bon mun na cee xew mooy ngeen dem sax ba nde yàlla tere ngeen di jëflante comme jëkkër ak jabar waaye style da ngeen a buggante buggi dëgg-dëggal ak sëy mooy seen intention am na ci ñoo xam ne bu ñuy dem ba àgg foofu seen bànneexu bakkan rek moo leen ci dugal daal benn nga xam ne jigéen ji amul benn intention pour sëy góor gi waaye dëgg-dëgg bànneexu bakkanam bugg naa faj bànneexu bakkanam
waaw dugga si
wala jigéen ji itam amul benn intention wala góor gi itam amul benn intention waaye bugg naa bànneexu am na ñoo xam ne loolu la am na ñoo xam ne nag ñoom ñaar ñëpp am nañ good intention pour sëy
waaw
waaye buggante boobu ju buggante te sëy amagut te ba pare ñu wéet loolu moo leen dugal ci ñu jëflante façon yi jëflante googu te jëflante googu soo ko tàmbalee dafay jafe nga bàyyi ko léegi nag ñu dem ba mu yàgg
waaw
ngeen gis na daal léegi da ngeen bugg a sëy nag for exemple foofu yow mooy sa laaj bi léegi nag foofu fuqahaa yi mooy Islamic schools of thought yi nga xam ne moo nekk ci suñ njàng ñun li ci ëppa ñu di leen tuddi ahlu sunna xanafiya la ak malikiya ak shafiiya ak xanabila ñoom ñëpp dafa am fuñ dajee waaye am fuñ uute ñoom ñëpp nangu nañ ne yees dagan na nga takk ko yees dagan na nga takk ko
nangu nañ ko ñoom ñëpp
nangu nañ ko soo ñëwee sax ci Malik am nañ ñoom it am nañ wax yu bokkut ak boobu sax ne dañ ko koy tere du ko takka waaw lu boobu mu bokk na ci waxi Malik mu mel ni Malik moo ci gën a tàng
moom bosam moo gën a
tàng wax na ne sax am na sax riwaaya bu wax ne doo ko takk ñu ne lu tax mu ne because nit ki dañuy jëflanteeg moom ci opposite intention am yes yow sax dañ la tere nga njaalo kon dañ la koy tere yow li nga bëggoon mooy nga sëy ko ba pare nga njaalo kon léegi dañuy jëflanteeg yow ci sa opposite bugga mooy dañ la ko punisher kon yow dañ la koy tere doo
ñu tere la ko
waaye man xalaat boobu ànduma ci parce que dafa mel ni li nga xam ne moo daloon waaja jëflante woon ak soxnaam ci bëccëgi weeru koor mu ñëw ci sang bi fekk ko fa ne ko sang bi mu ne ma ne ko torox naa mu ne ko lu xew mu ne ko dama jëflanteeg suma soxna ci bëccëgi weeru koor mu ne ko ndax man ngaa goreel jaam mu ne ko déedéet man yoruma dara ndax man ngaa oor ñaari weer yu toppalante man nga ko mu ne man li ma dal ni oora ma ci dugal di li ma def nii oor moo ma ci dugal ndax mun ngaa saraxe leexal juróom-benn fukki miskin mu ne man réew dëkk bi maa fi gën a ñàkk di mu ne man aw ma léegi benn waay ñëw indil yonent bi saa sallam tàndarma bu bare
waaw
yonent bi ne ana waa ji ki doon wax léegi ki ma doon waxat léegi te moom mu ne amul mu ne ko jëlal tàndarma bi nga saraxe ko mu ne ko hay man wax naa leen ne dëkk bi lii man maa ko gën a soxla waa dëkk bi yëpp
imaam kooku
yonent bi saa sallam ñu ne mu reeba nga gis déggee jëm yi di génn
ndeysaan
meaning li tax ma indi lii mooy koor naka lañ ko tuddatee waa ji nga xam ne moo jëflanteeg jigéen ji ba miinanteeg moom nga tere ko ne bum ko takk loolu dafa niroog lii because soo ko teree de bum ko takk te moom miinante ne dafay continuer di ko def te léegi ku nekkoon ci lu daganut nga dog ko kay nag ñu daganal ko moo gën ñu bàyyi ko noonu mu continuer di xaraam.
imam topic bii daal man bëggoon naa ñu may ñu 10 minutes.
léegi nag soo ñëwee ci soo ñëwee ci fuqaaw yi ci gàttal balaa ma tëjee ko noonu
programme bi jeex
ci gàttal dañoo wax ne majorité bi daal dañoo wax ne dana dagan nga takk ko ñenn ñi ne waaye da ngay tuub njëkk gannaaw boo tuubee ñenn ñi ne dee tuub gannaaw boo tuubee la nga koy def tuub mooy nga réccu ko bàyyi ko na tuub ci yàlla daal jéggalu yàlla ñaareel bi teg ci itam di nga ko laablu mooy lan mooy balaa nga ko takk di nga xaar ba xam ndax jël na ci yow ëmb wala jëmut ci waaye soo demee ci Abu Hanifa moom mu ne dagan na nga takk ko dagan na sax su fekk mu ngi ëmb sax nga takk ko ci ëmb bi waaw waaye nag doo tëddateeg moom fee wasinut waaye daal in général daal dagan na nga takk jigéen joo xam ne njaaloo nga ak moom dagan na loolu mooy wax bu gàtt bi
Imam jërëjëf thank you very much for clearing this xam nga ñun comme man time bu ma nekkee gën a ndaw ma jógee Kombo fii dem suma dëkka ma ne dama uti jabar waaye ñu ne ma ne ñun suñ luwaa bi fii soo buggee nit duñ la gisee moom because dañoo laajte ñi dañ doon ànda
ndax mos nañ koo gis mu ànd ak moom
suñ li fi neeloo man sax suma jabar doon moytu sax loolu
waaw
su ma ko ne waaye dangaa ñëw at li ñu toog si bunti kër mu ne ma
mukk ñu nit suñ dëkk noonu la ñun suñ dëkk góor du jegee jigéen
waaw soo bés buñ takkee si la am access waaw apart from
ñun suñ dëkk nit ñëw na nii takk jabar ba pare mu ànd ak ñaari moromam pour ñu ñëw si jabar ji bi ñëwee jabar ji laajte ne kan la ci kan moo ci
xamut
waaw kan la ci
Imam jërëjëf thank you yeah so viewers this is all we have we'll be back here again tomorrow for another edition until then enjoy the rest of our programs bye bye